welcome. I'm Julia Grapsa here live from EuroPCR in Paris, and it's a great pleasure to have Fabien Praz. Fabien, you're leading PCR Tricuspid Focus Group together with Francesco Maesano. Could you tell us more about the mission?
So thank you very much, Julia. It's a great pleasure to be here and to talk about the PCR Tricuspid Focus Group. So the group is a big group of experts. It's a multidisciplinary group, so we are more than 70 members now. And the goal is to look a little bit more closely at tricuspid valve disease. And this was an initiative of PCR, of William Wines, to address a little bit the confusion we have in this disease regarding the anatomy, regarding the patient selection, regarding which device of the emerging technology is appropriate for which patient, regarding medical treatment and heart failure symptoms of this patient, and the whole management. Because tricuspid disease is not only a disease addressed by a cardiac surgeon or interventional cardiologist, but by all subspecialties, including rhythmologists and heart failure specialists. So that's why we wanted to have it multidisciplinary, and we wanted as a main goal to align on messages and then increase a little bit awareness for this disease.
Thank you very much, Fabien. You have done an amazing job and you have gathered so many physicians together. And what is the next step of PCR Tricuspid Focus Group?
So by the start we saw that there were many, this in daily practice, there are many different opinions among these experts. So the first start was to align on the messages. We wanted to have something we can convey to the community regarding the treatment of this patient, diagnosis of tricuspid disease. And now we move to awareness, so we want to convey these messages to the broader audience and to make people aware of the disease, of the bad prognosis of the patient, but also of the new treatment modalities we have and that can be applied to patients with tricuspid disease. So it was really taking this problem from the beginning and then bringing messages to the community. And for doing that, we will start the program of the Referral Meeting that we will talk a little bit more about, I think.
So this is a brand new initiative of PCR Tricuspid Group, the Referral Meetings. So could you tell us more about that?
Yes, so what we have done as an initiative, we have looked for a solution to bring the messages to really on a local level, to people seeing the patient, referring this patient, doing echocardiography or looking at therapy for the patient with tricuspid valve disease. And the best way to do it is probably to go on the local level in the language of the people and do meetings where physicians can exchange about these people and this patient. And we will go to different geographies, and one of them will be London as well. And I think, Julia, we will organize a referral meeting very soon.
That's correct. So thank you for giving us this opportunity to organize the referral meeting in London. That will be 29th to 30th of September. And I need to mention, like, the local organizing committee, Professor Redwood, Simon Redwood, Dr. Tiffany Patterson, Dr. Chris Allen. And as you say, it's a magic interaction between the interventionalists, the imagers, the heart failure physicians, the care of the elderly physicians, the nurses, and also like the sonographers that they are dealing with these patients. How to get these patients early to the tertiary center, how for them to have earlier the best treatment possible in order to have the perfect management plan and to provide them a good quality of life. So anything else that you would like to mention?
No, I just wanted to tell to the people listening to us that PCR Tricuspid Focus Group is very active in the different congresses at EuroPCR here in Paris, but also in London Valve in the upcoming meeting, and that we have also visibility on PCR online. You will see cases, very interesting educational content. So stay tuned and look for the content produced by the PCR Tricuspid Focus Group.